Welcome once again to our series of lectures. Today I want to make a lecture on a particular point I usually like to tell my patients, that you don't need to just treat the pain. If you have arthritis, your interest should be to treat the cause of the pain. And the question is, what is really the root cause of the pain? Because if you get the root cause of the pain and treat it, the pain will go. Instead of masking the pain or relieving the pain, it's better you treat the pain from the root cause. Using osteoarthritis as a case study, we want to look deeply to see what is actually the source of the pain people have when they are suffering arthritis. The first point to note is a heady joint is painless. I don't have any issue with any of my joints, so none of my joints is painful, which means all my joints are heady. So if I'm having pain in my joint, it means there's a problem. So every painful joint has a wound. I like to use this word wound. Many of my patients will protest when I tell them, no, you're having wound in your joint, that's why you're having pain. They're like, no, I have not had any fall. I didn't have any injury, so there's no way I can have wound in my joint. Okay, fine. It is important for you to realize that arthritis is actually a wound in the joint. What do I mean? If you look at this picture, this is the knee. This particular knee here, you can see every part of the joint is very smooth. Just as you're looking at your skin now, any part of your skin that doesn't have any cut, any injury, very smooth. And you don't have pain there. So because this joint is very smooth, there's no crack in the cartilage or on the bone. The ligament is not showing here, but we are using this to demonstrate. The cartilage is very smooth, so this bone easily glides over this bone, painless, smooth and free. But if you now look at this second picture, this particular joint with time has started having arthritis, it's osteoarthritis in particular. That has led to the degeneration of this cartilage in this part. This part is still smooth, but this part has started degenerating. There are wounds all over the place, open space all over the place. The integrity of the cartilage at this point has been jeopardized. So this wear and tear here is wound. You understand? So because there are this loss of integrity, this wound here, the pain, this person will be having pain at this part of the joint. Unfortunately, it does not really point out from one place. When this thing is happening, the whole joint will be expressing pain. We are going to see the reason later. So if it is the ligament or the tendon, the same thing. Arthritis, as I have always said, doesn't start usually from the hard tissues like the cartilages or the bone, or else there's an injury or a fall that could have led to any severe damage, sudden damage of those particular hard tissues. But usually arthritis starts from the soft tissues like the tendons, the ligaments, the synovial membranes, and all the soft tissues around the joint. So this is Achilles tendon, which is found at the back of your ankle. If anything has happened, for instance, it will start with inflammation. For instance, if somebody is playing football and somebody tackles you and hits you, at the back of your ankle, it will give you pain. The pain it will give you is usually a pain due to inflammation. It might not give you pain. The pain you have there immediately might disappear, but after like a couple of days, you start having pain because that place has started getting inflamed. Okay? So when it starts getting inflamed, just as we can see here, there's a whole lot of fluid secreted around that place. That's why sometimes it has swelling. That's part of inflammation. That place will get swollen. There will be some release of toxic chemicals around that side, which will now be stimulating the nerve endings. We are still going to see that later. Through the nerve endings, it will now be communicated to your brain that something is going wrong there. Another thing that can happen, as I said, is the swelling of the place, just as you can see here. But if you look very well, you can see that the integrity of this tendon is still maintained. The strands, just at this heady part, is still the same thing as this inflamed part. No damage per se. The integrity is there, but all you could see is swelling, inflammations, secretion of fluid, redness around that place, and all that. That is inflammation. At this point, if you take painkillers, massage it, rest the joint, usually the inflammation would go. Okay, but inflammation is usually the starting point of arthritis, which is when that particular place has started degenerating. This is degeneration. So this is the heady part of this tendon, and this place is the degenerated part. So this inflamed part has started degenerating. All those chemicals released and all that, which had persistently continued to damage the tendon, has led to loss of the integrity or the strands of this tendon. So if you look here, you could see that everywhere here is matted up and is damaged. That's what we call degeneration. This is what we refer as wound. And the pain this one will give you will be higher than the pain inflammation will give you. You can see there's no swelling, there is still some redness, but because of this damage here or this wound here, there will be more severe pain. There might be loss of function. You won't be able to stand on that feet very well. Walking around becomes difficult and all that. Because of this wound, if you are taking medications like painkillers, which we are taking when you had inflammation, it's not going to work because it's not going to heal this degeneration. Okay? Now, why does this wound around this place cause the pain? It's because of the availability of what we call the nerves. Every part of your body is connected with nerve as well as blood vessels. In the joint, like in the knee, the cartilage doesn't have any nerve supply. So even if you are hitting it, it doesn't give you pain. But the surroundings, everything around that joint has this nerve supply, or what we call nerve endings, where the nerves end, and they are signal points. So if that place is having injury, it will stimulate the nerve endings, which will communicate through the sensory nerve, like this blue color is the sensory nerve, to the brain, through the spinal cord to the brain, telling you that there's a problem. Okay? So the yellow one is what we call the effective nerve, the motor nerve, which tells you, okay, fine, that place has pain, don't move it too much, just hold it, and that's what we call loss of function. Because of pain, it can't move. It's because your brain is communicating to you not to move, because the more you move, the more pain you have. The functions of these nerves is to carry the signal of the pain, and the pain is because of the wound. Okay, so the pain is not because of these nerves. So if you are doing anything, taking medications to stop the nerve doing its own function so that you feel better, you are not helping the matter because you are not solving the problem from the root cause. Okay, that's what people used to do. They now, when the painkillers or medications do not help, they recommend what is called nerve ablation therapy. Nerve ablation therapy is a process where you use heat to cut off the nerve, or electric wave to cut off the nerve. When you cut off the nerve, the pain or the problem will be there, or the pain will be there, but it will no longer be communicated to the brain. If the pain is not communicated to the brain, you don't feel pain. So that's the science behind cutting off the nerve, what's called nerve ablation. So when you cut off the nerve, the injury will be going on for all your care, but you feel good. You can be moving around as long as you have a way of sustaining that joint, no problems, because you don't feel anything. Does that solve the problem? The answer is no, because the problem is there. All that happens that you don't feel that it is stay there. You don't feel that it's not disturbing you because there's no more communication through the nerve as you have cut off the nerve. We now say no, that's not the best way to tackle joint issues. The best way is treat the root cause of the problem. The root cause of the problem is that degeneration, is that inflammation. If you can handle inflammation with the anti-inflammatory drugs like painkillers, fine and good. But when the inflammation is not going, you are taking medications on and the pain continues to go on, it means that it's no longer inflammation that's the problem. It is degeneration. And that degeneration has to be healed. And the best treatment to heal the wound or the degeneration in the joint is what we call regenerative therapy. Regenerative therapy, what it does is to heal that wound and restore that joint or the ligament or the cartilage back to normal. And one of the regenerative therapies done is known as platelet-rich plasma. It's a treatment where your platelet cell is collected from your blood. Take your blood to harvest the platelet cell, and they now inject it inside the affected joint. The platelet cells have what's called growth factors, plenty of growth factors. So those growth factors will be released and they will be growing that cartilage or ligament, tendon, whatever it is that had gotten degenerated, growing it back to normal and back to a healthy state. Okay? And when that happens, it becomes like that knee I showed you earlier on, everywhere smooth, everywhere glistening, and the joint will now be functioning normally. Okay? So this has come to be the solution to this problem, because it's what? It is tackling the problem from the root cause and not just masking the symptom, just as painkillers and other medications do. Thank you very much, and I believe you understood something from this. I hope you can share it with your friends and relatives and those that will be interested to solve their problems. Many people are languishing with joint pain. We have to do our own part to help them live better. See you again in our next lecture.